program. Yes. So before we start, can we have a question, some questions answered by you? If we can answer those questions. As people keep joining in the first few minutes, what we would do is we will just wait for everyone to join. Yes. So thank you. Thanks for answering the questions. And I hope my voice is clear. So there might be, if I'm playing a video, then there might be some disruptions. So just wanted to make sure that, my voice is clear. So just wanted to make sure you're hearing my voice, right? I see that some of you, 50% of you were not aware of CPHQ, what is CPHQ. So I will take some efforts to do that. And again, I'm okay. So if I, just to tell you that I'm in a location where internet connectivity is little, sometimes gets disrupted. I keep track multiple hospitals, multiple places. So in interactivity is distracting. I will tell my team members to support me in between. And yes, so questions. And yeah, so thanks a lot. And I think we can end the poll. Any other questions, my team, you would like to ask the poll?
Nothing, sir.
Okay, fine. Great. Thanks a lot. And yeah, so let us jump uh, into the see that so let me tell you one thing really. So those who are in the first bracket of the salary range, they can easily expect 30% to 40% rise in professional. So that's the power of a CPHQ certification. If you attend our session, you will get CHQE, means Certified Professional in Healthcare Quality. So some people are asking me at the end of the training, I have to do an exam. No, there is right now, today's training is just introduction. uh, You are not able to hear me. I think you can increase your voice. My voice, I think, is clear. Um, you may have to increase the volume, but otherwise, but sometimes it breaks. Okay, okay. So in case it's breaking too much, then I will expect my team to track the videos. Yeah, and accordingly take over. Okay. In case I find this internet connection, because I'm at a remote location in a hospital, it usually doesn't happen often, but this time it is. Yeah. So welcome everyone. Welcome to the training. And these are the uh, this will be the agenda. First, we will talk about the benefits of the CPHQ. We'll also talk about the modules. Then we'll introduce you to the module. Maybe two modules today I'm going to introduce you to. There are 7 modules in CPHQ, but I will introduce you to uh, seven two modules today. And but I will also give a brief introduction about other modules also. So we'll talk about healthcare data analytics. So most of the people, they find it very difficult to pass this examination in because of the healthcare data analytics module. So we will talk a lot about healthcare data analytics today. Okay. We will give you some examples of the projects all towards the end. And also, so thank you, Ralph. Uh, Ralph is there. Mohammed is there. Mohammed is telling sound is either good or it. Okay, there is one other option also. I play the video and I keep answering your questions because there's a better recorded similar videos. Alberto, you are asking, excuse me, and then yeah, so I have answered you. Uh, Katharina, yeah, Catherine is asking, is this will be recorded? Yes, it is recorded and it will be shared. Yeah. Okay. Fine. Mohammed is saying now it is perfect. So in case it goes away, I've got other options. In the industry for the last 18 years, and we have trained more than 150,000 professionals in quality, data analytics, Lean Six Sigma, and CPHQ. And some of the global clients, they are multiple hospitals in various countries, Saudi Arabia. We have many Middle East, GCC countries, Qatar. We have Al Sidr Hospital in Saudi Arabia, King Fahd Medical City. Um, uh, you know, then um, we have got International Medical Center, King Saud University, Sultan Qaboos University Medical Hospital in Oman, and then a lot of hospitals worldwide, and many Indian hospital. And I also take pride in telling you that highest qualification in quality is Lean and Six Sigma Black Belt. And I conducted the first ever Lean and Six Sigma Black Belt certification, and not only Master Black Belt, but also Master Black Belt certification in whole of Middle East. And that was in 2007 and 8. So that is why I take pride in telling you that, and for the last 15 years, I've been conducting the CPHQ trainings, and thousands of people have passed the CPHQ examination. 95% plus is a success rate of students trained by me, and in general, our organization has a 90 percentage. So we are pretty well known for our CPHQ trainings and passing percentage. So even Chinese hospitals, we have done many programs, and yeah, Europe, etc., and won certain awards. And multiple management Asia conferences we have spoken, and also National Healthcare Service. So I'm not sure how the video will play, but let me show you some of the work we have done. And this is our, one of my students who underwent the quality training and also Lean Six Sigma training, and he completed a lot of projects in National Healthcare Service in UK. And he's talking about just after he has done some good work, he had presented to the senior management and government official. He's immediately talking about the work done by him. So well, we have Alex with us, and he has done excellent Lean and Six Sigma projects in National Healthcare Service and in hospitals. So, Alex, would you like to tell us something about it?
Hello, I'm Alex, Head of Service Improvement at Liverpool University Hospital. I've been really fortunate to present today on how us as a trust are using Lean and Six Sigma principles to deliver better care for our patients. I've presented today on a lot of the work that we've done around how we've improved patient outcome, mortality, improving length of stay, and also talked about how we can actually realise some financial benefits from that. Over the past 2 years, we've been really fortunate that we've done some good work, and it's actually delivered us £2 million worth of quality efficiencies through delivering better patient care.
And King Edward Hospital also. Mr. Andrew Robertson with us, who's the CEO of King Edward Seventh Hospital. Anyway, so lots of TV programs also we have appeared on Z Business Show. Also, those from India, they can recognize that. American Society of Quality World Conference, I keep speaking, and this time I'm speaking on how to reduce the. So next, after 2 weeks, American Society of Quality World Conference, I'm speaking on how to reduce nosocomial infections using data analytics. So that will be live presentation, and it will be also available on YouTube after some time. I'll be happy to give you the link once the conference is over. This is about the past one I'm talking. Anyways, lots of I've written books also. Minister of Health, ministers of health in Saudi Arabia. Here is Dr. Tarif Alama. Then we have got Dr. Muhammad Abdul Ali, etc. They have also given a lot of good credentials. They have undergone our training program. We have got Sultan Qaboos University Medical Hospital doctors attending. So lots of videos are there. And in fact, if time permits, towards the end, I will talk about more about our credentials, especially on Saturdays only. It is held on Saturdays in six days every day. 6 hours every day, 6 to 7 hours. Otherwise, we hold the program every day in the weekday for 2 hours. So you have multiple options. Whichever option you want to choose, you can choose. And it talks about different modules. Let me give you a brief introduction, and instead of I showing my PowerPoint videos, let me show you the one which is given by HQCC, that is Healthcare Quality Certification Commission. So these are the 7 modules. What are the 7 modules? The first module contains quality leadership and integration. So it talks about strategic planning, and as a quality professional, how can you advise the leadership on organizational improvement opportunities? And the best way to improve anything in your hospital setup or any healthcare organization is to convert improvement opportunities into projects. And the basic definition of a project, is it has a starting point and it has an end point. It doesn't exist after some time. That endeavor, the project, is a one-time endeavor. So how to identify the best projects, how to identify the opportunities, you have to advise the leadership. And not only you have to identify the projects, but you also have to implement those projects. You have to execute those projects. So that is what is meant here when we say the first part of quality leadership in integration. So you have to integrate the quality within the strategy and planning activities of the organization. So we see here how to build a right strategy. What is mission? What is vision? Mission is something, it is about the purpose, why the hospital exists. And the vision is how the hospital sees itself after some time. So you learn how to create a vision of the hospital, how to identify the mission of the healthcare organization. It could be a hospital, it could be a clinic, it could be a lab also. And also how to align quality and safety activities with the strategic goals. So usually, see, when we are talking about uh, any organization, any healthcare organization, what we mean when we talk about leadership. So let me draw the system map, which is given here. Uh, Still, people are still joining in. So what I will do, I'll just uh, uh, wait a little bit for the tools and techniques part. I will just continue doing the brief introduction, and then I will start teaching you the tools and techniques. So quality leadership, strategic planning. So you have to have a vision, you have to have a mission. Based on your vision, what you want to do as a hospital, what you want to do. Based on the vision, you create your strategies. How will you achieve your vision? So we'll take some example, okay, in a short while. So strategic planning, the stakeholder engagement, how will you engage all the stakeholders? How will you when you want to improve something, you have to have a team. You cannot do it alone. You can't make it happen single-handedly. You have to have a team, and you have to have the stakeholders. Stakeholders are the people who are going to be affected by the improvement activities you are going to take up. So how to identify the stakeholders and how to engage them so that they promote quality and safety. How to assess the organization's culture of quality. Culture means behavior of a group, common behavior of the group. So every organization has a culture. It's a common behavior. In fact, every department has a culture. Culture is coming from the word cult. Cult means behaving. Group. Cult means group. Culture means behavior of a group. So how to establish good quality culture in the organization? Because if you are able to establish good quality culture in the organization, you will be able to very easily ensure quality and patient safety. And it's very difficult it takes a long time to establish quality culture. And in case if you are able to do that, see, people may come and go out of your system, but once the quality culture is established, half of the job is done. So how to have that systemic thinking, we'll see. Then performance and process improvement. So here, in this case, you have 27 questions. So 19 questions for quality leadership and integration. Then performance and process improvement, you have 27 questions. So here you learn about how to implement the quality improvement training, how to identify the projects, the roles, responsibilities, and scope, how to lead and facilitate a change. Then you learn about lean, you learn about PDSA, you learn about Six Sigma. In fact, recently, day before yesterday, I conducted a training on Yellow Belt Lean and Six Sigma introduction. Please attend that training. Next time when you want to attend, you can join any of our live webinar like this. Or if you don't have time or if you're in a hurry, day before yesterday's session, which I just recorded, I conducted this Yellow Belt 2-hour Lean and Six Sigma overview. Please watch that. So I request my team members to please, last two days ago, I think I had done that training program. Please post that link, and people will be, I think, happy to see. Talks a lot about data analytics and Lean and Six Sigma, which is coming from CPHQ's perspective. So save this link. 2-hour additional this is a video. It will give you a very good introduction about Lean and Six Sigma. So this is given about quality tools and techniques in this module, and then how to evaluate the team effectiveness, evaluate the success of the performance improvement projects and solution, and this is what is there in the performance and process improvement module. Then you have got the population health and care transition. So how how the CPHQ professional, how a quality professional, healthcare quality professional is impacting the overall population health by knowing these tools and techniques about data analytics. And some of them you will be learning today. So I will feel really happy. I see this is the webinar, so you may not be able to see each other's comments, but I can see your comments. So keep interacting. So here, population health and care transitions. So here, you know you understand how quality professionals, they are able to impact the health and health of overall population. Because see, every government is funding the and taking care of the healthcare of their citizens. Every government, directly or indirectly. So if you are able to reduce the cost, if you are able to improve the health of the general population, government spends less money, and then it has got additional funds for other activities for the general good of the population. So that is how we'll see. Then in data analytics, you also know what is the basic, how to collect the data, what should be the sample size, what are the tools and techniques of collections of data, what is the sampling methodology. Then we also know about systems approach, SIPOC, supplier input, process output, and customer, and I'll be introducing you to SIPOC today. Then collecting and validating the quantitative and qualitative data, identifying external data sources for comparison, benchmarking. So all these things. Then you also learn basic statistics like mean, median, mode, standard deviation, control chart. So today I'll be introducing you to control chart, a little bit of basic tools of data analytics also. Today I'll be talking about what is process under control, what is out of control. So all these things. Now, because it's an introductory program, I will not go into the details, but still you will get a fair idea and some good tools and techniques you'll be learning. I will not be able to detail of an important tool used in healthcare industry. And if you want, you can please, Chintan, sorry, Christian is asking, Christian Dave is asking, Christian Dave Santos is asking that, so I think my team can answer that part. What is the provision of the certificate? And you can say program to program, but you should be able to get an introductory certificate. And so we'll be sending you the the then so this is one part, and this will also help you to get the some of the times you have to fulfill conditions related trainings which you need to undergo. So this 2 hours gets added. Thanks for asking that question. So then we also will learn measurement data analysis in a normal CPHQ program. Today I'll be just giving you a brief introduction, and you will learn a lot of things today, I promise you. But FMEA, I was talking about failure modes and effects analysis. I will give you a link. Now, this is a 13-minute video. I have given an example, a very simple example of how to do FMEA, what is FMEA, and how to do an FMEA. So please watch that. In fact, I have got 1 million views on that video. 13-minute video getting 1 million views is something which must be useful for the people, right? So this is the one FMEA video. Please watch that, because I can't teach. I have a limited time. I can't teach you each and everything. But failure modes and effects analysis is very much used in all professional hospitals. It is one of the requirement of JCI accreditation. So please learn one tool in detail. I've just given you the link. Now you are telling me I'm giving you a link and I'm not teaching. Definitely, I'll be teaching you a lot of stuff today. But I'm just in advance telling you some of the things I covered with limited time. So please, these are also very important. FME is very, very important. In fact, if you can apply FME immediately, you can go and apply FME in next week, and you can improve something organization. So please go ahead with that. And so statistical process control, SPC, etc. These are part. And also, interestingly, there are 26 questions, 26 questions from this section. And this is considered to be very difficult, but we are expert. We are expert in this explanations of this particular topics in data analytics. I'm a data analytics trainer also. I'm a AI, artificial intelligence trainer also apart from this. Then patient safety, 18 questions are there, and mostly no one fails in this module because most of you have undergone some patient safety related training in your setup, work setup. So FME is also part of this part, patient safety. So this part is definitely has 18 questions. Then you have quality review and accountability. So government makes payments to the healthcare hospital, healthcare setups, and especially US government. And apart from that, I think every country's government has some fundings for those hospitals which are really performing well in terms of quality. So how a quality professional can help get better fundings. Sometimes there are penalties. If you are not performing as per the quality standards, then you get a penalty. So how to avoid those penalty? That also FMEA. Kartika is asking. Kartika Janaki Raman is asking. FMEA, failure modes and effects analysis. That is what the full form of FMEA. Okay. Yeah. So yeah, keep interacting. You can keep asking questions. I will be happy to answer your questions. I hope you got Kartika. Yeah. Yeah.
Sir, your
Thank you.
voice is
So
breaking.
okay, sorry. Okay, fine. Okay. Okay. I will just change over. So for some time, okay, like just give me 1 minute. Uh, is it okay? It is breaking at times, right? So,
Yes.
okay, then you will be learning about quality review and accountability. Uh, uh, and so quality review and accountability, how you can save money for the hospital, how you can get money from the hospital, from the government. And then regulatory and accreditation, like how to get the accreditation from government, like CMS or Center for Medicare Services. I'm a permanent resident of Australia. So how to, there also Medicaid is there, Medicare is there, US it is there. Every country has got certain health related benefits given to the hospitals and to the people. But if you have got some accreditation like JCI or Sabahi in Saudi Arabia or NABH in India, every country has got certain regulatory requirements of accreditation. Then how to get that whole journey is also taught to you. So with that, let me start. What I would request my team, because if you're getting internet issues, if you can just from so I've just covered the guidelines, general overview. So can we go to the part of the leadership? If you can just go to the part of leadership, and I'll try to share the screen. I'll just share what I'm referring to. So somewhere here, systems thinking. So so I will talk about first. Let us start with a simple topic of organizational leadership, and if my team can just, there's a video also which I may play or I'll ask my team to play, which explains the five levels of leadership by Maxwell. But if you can just, somewhere from here, if you can just carry on for 5 minutes, then that will give me some time to set up my internet or change over my internet. Okay. So leadership part is about systems thinking. So when you talk about, see, whenever you want to bring in a cultural change in your hospital, it starts with the leadership, and leadership starts with systems thinking. All of us are leaders in our own respect. It's not that only the CEO or the COO they have they have got the responsibility of leading. In fact, each one of us are leaders. And so even if you don't have any reportee, if you don't have any team member, also still you are a leader, because you are also influencing the culture of the organization. So what is systems thinking? See, systems thinking is about developing a system of thinking as a whole. So you should think about your organization. Think about your organization. And let me take you through a systems thinking model of Deming. Dr. Edward Deming, he was a great quality guru. And he used to say, in fact, he was the first person to say that a leader should have systems thinking. And he also used to say one more thing. In fact, 3-4 very famous sayings are there of Edward Deming. The one is, of course, leader should have developed systems thinking. Second, very commonly quoted is, the problems are in the processes, not in the people. Means 85% of the problems, to be very specific, he said 85% of the problems are due to the processes and systems and not due to the people. So if you want to change something in your clinic or a hospital, you have to change the processes. The same people will deliver excellent results. Okay. So what do you mean by systems thinking? So think about your own organization. Our organization actually follows our organization, we end up doing lots of repetitive steps. These repetitive steps, whenever we repeat something again and again, we call it as a process. So we have step number A, B, C, and D. Some examples of process could be patient treatment process. Patient treatment is a process. Patient discharge, discharge of the patient is a process, discharging a patient from a hospital I'm talking about. So that is also a process. Similarly, performing a surgery, that's a process. So in any process, you have steps which you keep repeating again and again for a long time. That is repetitive process. That is what is known as like this. I keep doing 1 time and 2 times and 3 times and 4 times again and again. If I keep doing something, we call that as a process. And process always delivers an output. Okay. Process always delivers an output. And output could be in the form of a product or a service. Product or a service. Okay. This output goes to a customer. This output, it goes to some customer. Right? And the customer gives a feedback to a team in our organization. So strategic planning team, board of advisors, any team which is responsible for creating strategy organization. So taking the feedback from the customers and also sometimes the demand of services from the customer. Like I'll take an example. In during COVID, you had got we used to predict the demand, okay, demand of our services. So in this case, predict based on the predicted demand and based on the feedback of our services from the customers. See, customers could be patient, customer could be relatives of the patient, customers could be Ministry of Health. Yeah. So there are different customers. Customers could be internal, customers could be external. So I'm talking about, like, if I'm taking the system of a hospital, then customers would be the patients or the Ministry of Health. And if I'm talking about a particular department, see, system map can be developed for a department also. So if I'm talking about a department, let's say a process of in a lab, let's say, so I'm generating reports. So a blood test report, let's say. So blood testing, the blood is one process. And again, this whole system even fits into that process also. So the system, when I'm talking about, I'm not talking about only the hospital. The system map could be for a department also. So strategic planning team will advise the suppliers. Yeah. Suppliers to supply the relevant raw materials and inputs. Raw materials and inputs. Inputs are the processes. Inputs are processed and they are delivered as outputs to the customer, and this whole process goes on and on. So this whole process keeps happening again and again. And if there is if there is enough smooth flow of these process execution in our system, we say that our system is healthy. But if there are interruptions, if there are blockages, let's say B is fast, but C is slow, so then you will see a lot of waiting time in the system. A lot of work in inventory stuck in between, which we call it inventory, work in process inventory, stuck in the whole process. So all these things are going to make the process unhealthy. The way, as a human being, if you look at our health, if our breathing is smooth, normal, we are healthy. But when we are unhealthy, the first thing what gets affected is the breathing. Similarly, if there is a continuous flow of inputs being processed, delivering the outputs, going to the customer, and we are getting the feedback, and we are making our plans accordingly, and if this smoothly flows, we say our system is healthy. But when this flow is not smooth, then we say that there are diseases in our system. And how do they manifest themselves? How do they reveal themselves? The disease of a system is revealed as patient complaints, patient dissatisfaction, or customer complaints, customer dissatisfaction. Customer could be a Ministry of Health also. Delays, errors, rework, all these are examples of unhealthy system. And as a leader, I have to understand that I am responsible for the system's health. And this is known as systems thinking. So as a leader, you are responsible for giving strategic direction to your organization. And how do you do that? You start with a vision. So whenever we are talking about leadership, these two terms you will be encountering most of the time: vision and mission. Mission means how do you see your organization after a certain time. Mission means what is the purpose? What is the purpose of your existence? So purpose of existence is mission. Purpose of existence is your mission. And vision means how how do you see yourself? How do you see yourself after a certain time? Vision, 2030 vision, 2035 vision means by 2025, my hospital, child pediatric hospital, this is a vision. Mission is to take care of every sick child in the city. Or mission will be to alleviate suffering in children. That could be a mission. Mission generally remains the same. It doesn't change often. It remains for a long, long time. Vision keeps changing. Vision means, 2025, your vision would be different. 2030, your vision would be different. So vision keeps changing, but mission remains constant. So as a leader, you have to develop the vision. As a leader, you have to be aware of the mission of your organization. And based on that, I create our strategic goals, strategic plans. What will make me number one hospital by 2025? So what are the things I should be doing in the next 2 to 3 years? Okay. So you will first assess your own position. Where are you today? What are your capabilities and what you need to do to achieve your destination? And you create a strategic plans, etc. You find that you create some plans. That's what a leader is supposed to do. And if your vision is clear and if you are able to share the vision with your team members, that means you are a great leader. And that's what is expected. So this was very brief about the leadership. Today I'll be talking briefly about each of the modules. So this was about the leadership module, the first module of CPHQ. And we tell you how to develop the strategic plans. We give you some examples of a balanced scorecard. What do you mean by Hoshin Kanri? There are a lot of good tools which will help you to become a great leader and also establish quality culture in your organization. Now let me go to the next one. So this was about leadership. There is a very good video which I have created about 5 levels of leadership. There's not much time to play this video, but I will request my team to put this in the chat box. This leadership the 5 levels of leadership talks about the 5 levels of leadership given by Mr. Maxwell, and he's a leadership guru, in fact. So John Maxwell's 5 levels of leadership is one thing which I request you to just go through this particular video. In this video, if your actions inspire others to dream more, learn more, do more, and become more, then you are on the path to becoming a great leader. In this generation where technology has become so advanced that it is available to everyone, the only competitive edge a company can get is by improving its leadership. How important a good leader is can be explained using the examples of many companies that rose to skyrocketing highs. As I told you, I'll be leaving you with this video, and please go through the video. There's a 5 levels of leadership, and where do you belong? You can determine your own leadership as well, because the level your organization can achieve is actually decided by the leadership level. So if you are, let's say 5 levels are there of the leadership, and you are at level 3, so your organization can never go beyond the level of the leader. So everyone will be stuck at level 3 position. If you are at level 4, so you will also take the hospital or your clinic to the level 4. So you can't go above that. Your organization can't go beyond the leadership level. So as a leader, you have to raise your own level. That's what the essence of that video is. Please go through that video. I'll leave you with that video. My team will has already put that in the chat box. And please store these. I strongly request you to please store these links and go through these links after the training. Okay, now let me talk about some of the basic concepts of hospitals, lean in hospitals. See, our hospital is about high volume, high variety, high variation, high speed, high stress, high turnover, highly regulated. One of the highest regulations are stored for the healthcare system, right? So it leads to often service breakdowns, wasteful processes, and medical errors. So we are talking about now. Let's talk wasteful processes. So what are some of the basic lean concepts? It is about war on waste, trying to identify the waste in our system and eliminating them as much as possible. Processing, motion, walking, searching, waiting, transition, supplies, capacity, inventory, man hours, production. So these are all hidden wastes in our systems. The 7 or 8 popular wastes are intellect, waste of intelligence, scrap, waiting, inventory, motion, transportation, overproduction, overprocessing. Some of the wastes are obvious, but many of the wastes are hidden. So we are talking about the hidden waste like overtime, overstaffing, rework due to errors, subsidies. If I take a simple example of a blood test, there are many steps involved in that. But what are value added and what are non-value added? In Japanese, we called the non-value added steps as muda. Muda means waste in Japanese. So what do you call it as a waste? Waste is something which the customer is not willing to pay for, not willing to pay. And so value added activity is any activity which the customer is willing to pay for. And non-value added activity or muda or a waste is something what the customer is not willing to pay for. The second part is you should do it right the first time. So anything which is not done right the first time, that is a waste. So if you commit a mistake and then you rectify that mistake, committing the mistake and wasting the resources of our organization is a non-value added activity, muda. That is a waste, isn't it? So customer should be willing to pay for. You should be doing right the first time, then it's value added. And the third thing is, it should transform the input So in this case, if I'm defining waste, then it should say it does not transform. It does not transform the input and bring it closer to completion. Means any step which is not taking you towards completion of what your objective is a waste. Okay, so let us take some examples. Some examples will help you to understand. So walking to the OPD. Now you may say that, yeah, it is required to walk to the OPD, but from customer's perspective, from patient's perspective, what is the value addition patient is looking at? Patient is looking at knowing the health status. In fact, physician is also a customer here. So physician is interested in knowing the health status of the patient. Now, walking to OPD is not adding any value. Please remember, walking to OPD is not adding any value. Registration is not adding any value directly to the customer. Think about value from customer's perspective, not from your perspective. So in this case, we will say that only two value-added steps are there, drawing the blood and processing the blood test. That these are the two value-added steps and remaining are non-value-added. So we need to reduce them as much as possible. We can't eliminate, given the technology constraints today, we cannot eliminate that, but we can definitely reduce them. So trying to achieve this reduction of muda or the waste in our hospital is lean. I'll talk about a little bit of other techniques, PDCA, Six Sigma, FME also, but we will go one by one. There are, I'll tell you, these are the wastes in our system: waste of intelligence, waste of rework defects, waste of waiting, waste on inventory, waste of motion, waste of transportation, waste of overproduction, waste of overprocessing. So let me give you some examples. Waste of intelligence. Now, many times you will see that patients call the nurse for some simple things, that why my bed cover is dirty, my pillow is not okay. Now, this is waste of intelligence of nurse. If you ask the nurse to get involved in all those other activities, she will forget to give you the medicine. Means if you involve a person in non-value-added activities, the person will not be able to, or the focus of that person will reduce while delivering the value. So involving a person in activities which can be done by someone else, not using the person's intelligence to his own capability, that is known as waste of intelligence. Now, these are all hidden wastes, and these are often ignored wastes. So this is something, you need to take care of. There are so many examples. I've just pulled out some of my material, from our CPHQ training, and I'll just go through. I'll pick up some of the examples, some of the topics. Let's take an example of this hospital, which doubled its cardiology lab capacity from 8 to 16 by just redesigning the work without adding more staff. In a single day, the capacity was doubled. Again, applying these principles of process improvement. In one hospital, patients had to wait up to 6 days between cardiologist exam conducted in the doctor's office and the treadmill exam conducted in diagnostic lab. The action was after observing the flow of patients from the cardiologist's office to the diagnostic lab. Two physicians decided to see the patients in diagnostic lab itself. So now patients make appointments to see the cardiologist there. The daily schedule for diagnostic exams was changed so patients could get both exams done on the same day. So most of our processes, unfortunately, are designed keeping in mind the staff of our hospital, the physicians in mind. In fact, you have to keep patient in mind. You have to design your processes as per the patient's requirement. And when you do that, suddenly, like this hospital, initial diagnosis to exam time for treadmill exams was reduced from 2,000 minutes to 64 minutes. So few days to few hours. This is what transformation is about in process improvement. So there are so many examples. I just wanted to give few. You can reduce a lot of signatures, a lot of approvals. See, any approval is not adding any value to the system. Unfortunately, this is true. We think that approval is very important, but actually all the approvals can be done away with. Approval is not adding any value. See, why the approval was required? See, 10 years ago, the technology was not so advanced. Okay, just think, what does the approver do? What exactly he does? He actually takes the responsibility of the errors. Yeah. So what we want is the two people, 1% should check, 2% should check, 5 people should check. And you will see that when you commit more mistakes, you will add on checks and inspections. Why do you commit mistakes? Can you reduce those mistakes? Can you work on reducing the errors and mistakes to zero? When you have zero error, there is no requirement for checking. Then there is no requirement for approvals. So all these mindset change has to happen as a quality person. We try to bring in during our sessions. Idea is to eliminate waste and create value in the system. So first we identify the value. And once you identify the value, then focus on only value adding steps and try to reduce non-value adding steps. That's the whole idea. So we first map the process, identify which is value added, which is not value added. Yeah. And once we identify the non-value added steps, we try to reduce and eliminate them. Okay. So let me give some examples rather than just talking about theory. Unnecessary process motion, unnecessary waiting time, errors, unnecessary transportation. These are all wasteful steps in our hospitals. A person who's underutilized is a waste. Person who was overburdened is also a waste. Like if you tell the nurses to do 2 shifts, in the second shift, the probability of committing the mistake is more. So one waste leads to another waste. You commit mistakes, then you rectify those mistakes. It is a bigger cost to the hospital rather than hiring a new nurse. So these are certain things, certain mindset change leaders have to develop. And that's what some of the CPHQ topics are all about. Any equipment which is not utilized, underutilized equipment is a waste. On a funny note, like cost of 5-minute walk, empty walk is a waste. Even walk to elevator and elevator wait, and you add on elevator travel, walk to lab or pharmacy. So everything, that's cost per hour. If you look at many of our work has been in UK and US, so I'm just trying to give it. These are generic examples, but again, 50 to 60% of my the trainings have been in the Middle East. And somehow I don't know, it was never designed like that, but like 15, 17 years, I've been into most of the time I ended up doing training programs and consulting for hospitals in Middle East, and not only hospitals. I've got other clients also in different industries. So this is about a hospital. Like a nurse cost per hour is 50, and if you go on calculating cost of 5 trips per day per nurse is 25, and if you have got 200 nurses, you can imagine what could be the cost of poor quality. Or see, these are all costs which are not adding any value to the system. So in multiplied by 200 nurses, multiplied by 365 days in a year, it ends up into a few hundreds of thousands of dollars. And these are all hidden wastes. Lab and pharmacy on second floor and radiation equipment in ground floor. So there is a lot of movement waste, lot of to and fro movement. This is all wastes. Why not have everything on the same floor? Reduce the non-value-added activities. Eliminating the exam room interruption. Any interruption is a waste. Okay. So any fluctuations, like you have, you can, this is a typical, many hospitals, have this display of performance. Patients are waiting to get admitted, and the discharge of the patients is happening in the afternoon. Okay. So that waiting time of the patients increases, right? So Glory, you have a question? Yes, please. You can write in the chat box. Yeah. Or anyone has a question, you can write in the chat box, and also you can write in the Q&A as well. Okay. Yeah. So what we are doing here is we are trying to identify these wastes due to imbalancing of our operations. Patients are waiting, and we are still waiting for the patient to get discharged. Why can't you reduce the discharge time? So again, some visual controls which could be applied. See, alert on error-prone products. We can use some techniques, visual controls, which will reduce our errors. Indented surgical instrument tray, a visual hospital. Here, indented surgical tray means it is going to prevent the mistakes of forgetting something during the surgery. The visual hospital means if you go to the hospital, the patient should not be asking any direction. See, asking or seeking direction is a waste. everything should be crystal clear. It reduces a lot of wasteful time. If you have, like, just a day-to-day example, rice cooker, it stops if it overheats, isn't it? This is known as mistake proofing, also known as pokayoke. Pokayoke in Japanese means mistake proofing. Even by mistake, you cannot commit a mistake. Automatically, the equipment gets switched off. So this can be easily applied to our healthcare also. One example could be the smart machines, which cannot be set or operated beyond normal, safe, or maximum levels. So that is again example of waste. So Banan is asking, do we need to buy a book or for a CPHQ exam, or the course is enough? Course is enough. You don't have to buy any material. See, we have actually prepared the material from the NHQ book only. So we have got those things with us, and based on that we have created the material. So you don't have to buy anything, and we take you through the different situational questions. All the questions related to the CPHQ syllabus, and we prepare you well for the CPHQ examination. And our passing percentage has been very, very high. It is above 90%. So, which is very, very high for any institute. And we are one of the most well-known institutes, just to answer your question, Vanan, who have got lots of, in fact, yesterday only, Dr. Kuri's Knight from US, she told us that she has passed the CPHQ examination. Similarly, we have got a lot of people working in Dubai, Abu Dhabi, a lot of nurses in Saudi Arabia, a lot of physicians in Saudi Arabia, Qatar, UAE. They have passed the CPHQ examination. But just by attending our sessions, you don't have to really buy any material. Our course is enough. If you are interested, we will, maybe my team can write, if you can give a link here of how to register for the course. My team will be happy to give that link, and you can always register for our course. I'll tell the details of our course after a while. So yeah, some of the abnormal values will be rejected. You cannot connect oxygen to nitrogen because the connections themselves are different, right? So this is an example of pokayoke. Now, these are quality tools and techniques to prevent errors, to prevent mistakes. Like other examples could be fixed number of packages during the surgery, a complete catheter kits for insertion, prepackaged medication cart with correct dosage. These are all, again, examples of pokayoke. Pokayoke means mistake proofing. Okay. Now let us go to the little analytics part. So do you agree that some of the things, in fact, I told you what Deming said. Another interesting quote of Deming is, you cannot improve if you cannot measure. So let me ask you, can you measure everything? Or do you agree with this? Some things can be measured and some things cannot be measured. Just let me know. Okay, so Deepika Patel is telling that everything can be measured. So it appears you have attended my training program. Yeah, so everything can be measured. Yes, you're right. So now how? Yeah, how? That's what, how. So you cannot improve if you cannot measure, and you can measure everything. So there are two types of data. Continuous data and attribute data. See, first of all, when we think about data, we have got some people say, I don't collect the data, or I don't want to give the data. Some people say, I'm not comfortable in giving you the data because you will do some graphs and charts and reveal my inefficiencies to the whole world. So means I'm afraid, like you're asking me data of the errors in my department. That means, you are making some report which will put me in trouble. So I don't want to give you the data. But what if someone tells you that he or she is there to help you to reduce the errors in your department? Then you will be happy to give that data, right? So you have to also, as a quality professional, you have to seek the data with proper approach. You have to tell the people that you are here to help them. Then only people will give you the data. Some people say we have too much of data, but I don't know what to do. So today you will learn. Now I'm going to show you how you can analyze. How easily you can analyze. See, nowadays you have got tools and techniques. Everything is automated. Now, CPHQ is not going to test you in those, how to do it. It just expects you to know that some things like these exist, and you should have access to these things. You can recruit staff. You can hire people who are those experts. But as a leader, as a quality professional, you should be aware of what is happening in the healthcare industry. So I will show you some of the glimpses of that. Another thing, it is not related to CPHQ. I have given in International Medical Center, I had given a lecture on AI and data science applications in healthcare. I strongly recommend you please watch that video. It's a 2-hour video. By the way, it is not related to CPHQ. I'm just those who are interested to know what's happening new. Nowadays, you must be hearing about AI, data science, and we do a lot of work in AI and data science in healthcare. I'm also on the board of advisory of some of the AI and data science applications ministry of 2 countries. So that 2-hour lecture will definitely help you to understand what's happening. What do you mean by AI, artificial intelligence and data science? You'll get a very good idea about these applications in healthcare, and you will be like, I would say you'll be in tune with the times. Yeah, fine. Now coming back, we have. Some people say data analysis too complicated. So it is not at all. So let us understand there are 2 types of data, continuous and attribute data. Okay, Baran is asking, when is the nearest CPHQ examination? Nearest CPHQ examination is actually, for you it will be June, last week of June. So last week of June, and our course is starting. I'll tell you the dates also. Can my team tell me the date? Is Naveen? Yeah. So AI and data science for I just you can just watch whenever you want. Okay, so now coming back, I will tell you the dates also. Let me, my team, if you can just tell me the next dates. In March 1st. These are usually the exam dates. And you can write the exam from your home also. Okay, you can write the exam from your home also. Okay, so now coming back to the learning part, we have 2 types of data: continuous data and attribute data. What do we mean by continuous and attribute data? Continuous data is about continuous data is something which I can represent on a number line. something which can be represented on a number line. Now, what do you mean by that? Number line is a line which goes from minus infinity to plus infinity. It means any point on that line, like 23.646. Patient waiting time, 22.63 minutes. So you have a unit and you have a decimal point. Yeah. That is known as waiting time. It's continuous data. Patient discharge time. Discharge time of patient. 2.3 hours. Okay. Now, attribute data is something which we feel is difficult to measure. Like, for example, can you think of anything in a hospital which is difficult to measure? And I'll tell you the way. I can tell you the way how you can measure the same thing. In fact, I will tell you the generic way, the generic solution. And you can apply this to anything in your hospital. Yeah, so Kauthar is telling that, is it enough to pass the exam? Yes, this course is enough. This course means 4 days to 5 days training is enough. In fact, 4 days training is enough. We conduct a 4-day training, and you can attend as many days if you want. Like next batch, you can attend as many times till the time you get the confidence. In fact, in the first course only, you will get the confidence. And this 4 days, which is generally happening on a Saturday. Usually we do training programs on Saturdays and you can attend them. These 4 days over the 4 weeks, you get prepared for the exam and that's enough. That's it. Yes. Okay, now, let me go back to this. So Santosh is telling questions counseling, Arav is telling patient dissatisfaction, and Srinivas is telling patient dissatisfaction. Yes. Santosh telling good evening. Yes, okay, good evening. Yeah, Santosh, thanks for joining. So we are starting the session on March 11. For your information, coming Saturday, we are starting a new batch. So do join us. Okay? We're starting a new batch. So the attribute data. Patient satisfaction. So I can easily create minimum 2 categories of whatever I want to measure. Categories is satisfied, dissatisfied. So one trick to measure anything, whatever we want to measure, is create minimum 2 categories, which is presence or absence of that attribute which you are trying to measure. What you are trying to measure? We are trying to measure patient satisfaction. So what are the 2 categories? Presence of patient satisfaction or absence of patient satisfaction. Means satisfied and dissatisfied. Now try to apply this to anything which you want to measure. And you will get your measure. Put it like a pain, no pain, yes pain. Or you can have a scale also. Like here, I could have had 5 scale. Highly satisfied, satisfied, neutral, dissatisfied, and highly dissatisfied. but still they are also categories. Okay. Although I can assign numbers to them, 1 to 5 scale, but they are still categories. Please remember, they don't become continuous data. Continuous data has to have a unit. Continuous data has to have a possibility of a decimal points. But here you will have a count. So out of 100 patients, 60 are satisfied with my services and 40 are dissatisfied with my services. That means proportion means out of 1. What is the portion in 1? Proportion. So here it is 0.6 and 0.4. Proportion. 0.6 and 0.4. This is known as proportion. And then comes percentage. Out of 100, if this circle is 100, out of 100, so this is 60% and this is 40%. This is percent. These are all measures. Okay. I hope you are with me up till here. Yeah. There are two types of data, continuous and attribute. Now, how to deal with continuous data? How to deal with continuous data? Continuous data, first of all, when I collect any continuous data, I have to display. I have to tell the whole world how am I performing. Like discharge time. Discharge time. Most of the time, I discharge in 4 hours. Sometimes it is 3 hours. Sometimes it is sometimes it's 5 hours and sometimes it's 6 hours. Sometimes it is 3 hours. Sometimes it is 2 hours and sometimes it is 1 hour. So how many times I discharged? This out of 100 patients, like 40 patients, I discharged in 4 hours. Around 30, I discharged in 5 hours and so on and so forth. So what's happening here is I'm making a frequency chart. How will I make a frequency chart? Histogram, historical graph. I collected the data of my patient discharge times in the last 1 month, and I make a chart telling that this is how my process behaves. And typically you will find almost all your continuous data like waiting time, discharge time, blood pressure of patients, age of patients coming to your clinic, they are all following these types of distributions. Any continuous data will follow these types of distributions, and this probability distribution is known as normality distribution. Normal distribution. Normal distribution means it is normal to obtain a normal distribution. Like, as I said, time taken to perform a surgery. If I collect 30, 40 samples of surgeries, you'll find that, it is taking most of the time, it is taking 60 minutes, sometimes 70, sometimes 75, 80, but never goes beyond 80 and never comes below 40, 45. This type of distributions exist in our system. I have to just collect 30 samples. I have to just collect 30 samples, and this will give me maximum information about the whole process. That's the magic. That's like a secret. It's nature's secret, you can say. What is that? If I collect 30 samples from any process at random, like let's say I want to, let's take an example. Let me continue with the example, patient discharge time. And I will solve this problem also in our hospital using some tools and techniques. And in the whole journey, we will learn some tools and techniques. So I think half an hour to go, right? My team just let me know because sometimes I lose track of the time. I keep on going. so, so accordingly, I'll structure my program. So in the next half an hour, you are going to learn a lot of statistical tools. Please be ready to learn that. And they are all high-end statistical tools and all part of your CPHQ syllabus. Okay, and this is the area where most of the people, they just, they say, oh my God, this is a normal distribution or control charts. I can't, I've run away from there. It's easy, actually. It's the easiest part. Sometimes I feel it is easier than the leadership model, which people find it much easier. Patient safety, they say, oh, it's so easy. We know we can, pass that. And in fact, patient safety questions, everyone passes. They're very, very easy question. Easy means, you know about it. But the data analytics is like sometimes it's a totally new subject for some of you. So that is why. So we focus, especially in our training programs, we really focus on it. We also give you all the recordings of the training programs. Whenever we interact a lot. Now, this is like a lot of people are, attending this training program. So I cannot have everyone on the panel right now. But when we are doing the session, generally it's around 15 people, not more than that. Okay, we generally take only 15 batches. If some more people are there, we request them to come in another batch. So, but we keep it because interaction happens. Otherwise, if you got, let's say, a lot of people attending the session, then it's difficult to interact individually. So my generally the way we do it is like we interact a lot. And you have to ask the questions. If you're not understanding, you have to ask the questions. So now coming back, this is our histogram, and this is only for continuous data. Okay. Now let us look at attribute data. I cannot make a histogram here because it will never follow normal distribution. In fact, let's say satisfied and dissatisfied. Here I will make a bar chart. Bar chart like satisfied, dissatisfied. If I have got 5 categories, I will make 5 bars. Highly satisfied, dissatisfied, neutral, etc. Or I can make a pie chart. So the pie chart or bar charts are for attribute data. And whenever you are dealing with attribute data, you should always talk in terms of proportions. Okay. And some of you, those 20 people who have joined today, who have attended my training sessions of Green Belt and Black Belt Six Sigma, they must be knowing when we deal with attribute data, we talk about proportions test, 1 proportion test, 2 proportion test, and chi-square tests. Okay. And when we are dealing with continuous data, we talk about t-tests, 1 t-test, 2 t-test, and then ANOVA. I hope you still remember. But anyway, let's not deviate from the topic. Okay, coming back. So there are 2 types of data. Now I know how to display my data. No, I'm not here to display the data only. I'm here to solve the problem. As a quality professional, you are not expected to only check like, your commit a mistake, your infection rate is 2%, you're making a chart and graphs. The quality department is not only for that. Quality department is there to solve the problem. How to solve the problem? How do I solve? So you have to do root cause analysis. Now, before I go to the root cause analysis, although time is a little less, but still I'll try to do a little fast. But let us understand, before I go to the root cause analysis, where you can use cause and effect diagram, Pareto analysis, box plots, and scatter plots, which I will talk about after 5 minutes. But in the next 5 minutes, let me tell you one more thing. And what is that one more thing? Every process, like say, suppose I just, let's take an example of discharge time. As I told you, the process follows normal distribution. Normal means like a bell-shaped curve. So let me describe this a little bit more. Mr. Goss he found that all the repetitive process, Mr. Gauss, Carl Friedrich Gauss, this is known as Gaussian curve also. 17th and 18th century, he studied this curve for many years and found some strange quality. That every process, every repetitive process, if I take patient discharge process, every repetitive process has got an average. They present this is X bar. X bar means mean, average. Average is 30, let's say, patient discharge time is, let us say, in minutes. If I talk in minutes, how many minutes? 30 minutes means around 5 hours. Yeah. Typically, hospitals have 5 hours they take. In the morning, patient knows that you are going to be discharged today at 8 a.m. And then after 12 noon or 1 p.m., he goes out of the hospital. It typically happens, right? So it takes around 5 hours. And standard, so also one more thing he found, Mr. Gauss, he found one more thing. It has got something called a standard deviation too. Standard deviation can be easily found. Now I've got a very good video on theory of standard deviation, how we derive the formula for standard deviation and all that stuff. This I will not tell you in this program, but if you are interested in knowing that, I'll give you the link. What is standard deviation, how to calculate standard deviation, and how do you derive the formula for standard deviation? That also I have revealed. But, because this is a very introductory program, I'm just keeping the things a little simple. But trust me, calculating standard deviation is very easy. Very easy. It's not difficult. And nowadays, you go to Excel sheet and you will be able to easily calculate. If time permits, I will play that video after the session is over. Still, if you can wait for another half an hour, I will answer these questions. But right now, please trust me, that's very easy. It is very easy to calculate the standard deviation. Let's say I calculate the standard deviation and that is 30 minutes. So this is 300 minutes, or I'll say 5 hours, and this is 0.5 hours. Okay, we can make it this way also. Unit can be anything. Now, an interesting thing Mr. Gauss, he observed. What was that? He observed that always, if I collect the data from any population, any given population, plus minus 2 times standard deviation, will contain 99% of the total population. 99% of the total population. What do we mean by that? So suppose I want to know, let's say there are few billion people in the world today. What is the pressure, blood pressure of whole world? I want to know the range. What I have to do, 30 samples I collect at random and get an average and get a standard deviation, which is a standard deviation, as I said, very easily can be calculated. In Excel sheet, you can calculate. But if you are interested in knowing the formula, there's a formula also. My team has already put. You can just watch this at later stage. It gives you step-by-step way to calculate the standard deviation. By giving an example also, it tells you what is standard deviation. Standard deviation is actually average deviation from the mean in a way. So what Mr. Gauss found, 99% or 99.73% to be more precise, is lying between -3 times to +3 times the standard deviation. So let us take an example. I collect the data of, let's say, a hospital. If I go with the minutes, I can either take minutes or I can take hours. What you are comfortable with, you tell me. I'll take that example. You want minutes, or you are okay with the minutes, or you are okay with the hours. The calculation remain the same. So let us take, if I don't get an answer, then I'll go with the hours. Let's take hours. Okay, yeah, I was telling hours. So averages. So I'm just taking writing here. Average is 5 hours and standard deviation is 0.5 hours, right? Half an hour, right? So here it will be 5. What will be one time standard deviation? 5.5. What will be 2 times standard deviation? 5 plus 2 times 0.5, right? Which is 6. And what is 3 times standard deviation? 6.5. I hope you are getting it. Please ask me any question if you are not getting it. Minus 1 times standard deviation is 5 minus 0.5. This is 0.5. This is 4. And this is 3.5. So I can say that in my hospital, the patients wait when they are waiting for the discharge from the hospital. They wait, minimum they wait for 3.5 hours. And maximum they wait for 6.5. We call it as lower control limit and upper control limit. LCL and UCL. Lower control limit and upper control limit. LCL and UCL. Okay. I hope you are with me. So how do I get my control limits? Okay. See, nowadays it's very easy. If I, there are a lot of tools. We give you this tool also, which I'm showing you. But right now, don't worry too much about this tool. In Excel sheet also you can prepare. So, I reveal one patient got discharged in 4 hours, 5 hours, 6 hours, 5 hours, 5.2 hours, 4.2 hours, 5.1 hour. 4.9 hours, 5.7 hours, 5, okay. So I've just put 6 example. In Excel sheet also it's very easy, but let me use many tabs. There's so many. This tool also we give it to you. So this is how, sorry, I chose the, just give me 1 minute. Yeah. So this is how I just put a few terms, a few samples. Actually, I should collect 20, 30 samples. So this is how it looks. Mean is 5 hours approximately. 4.9 is 5. And standard deviation is 0.6, which is 0.5. And let's take 0.5. So this is very easy. Nowadays, in Excel sheet also you can put and you can ask. Please go with me. Means if you want, I can show it to you, but it will take away some time. I can even show it to you. If you want. It's very easy. Put the numbers and ask for standard deviation. Okay. Put these numbers. Okay, I'm just putting some numbers. And is equal to average. Calculate the average of this. I just put some random numbers, okay. 5.5 and standard deviation is equal to STDAV, standard deviation. Very easy. 0.8, so very easy. Just put the numbers, you'll get average and standard deviation. But what you should do with the numbers, that is important. I can predict all my patients during the whole year. This is the way I operate. In this hospital, average is 5, standard deviation is 0.5. So I can predict my control chart. This is known as control chart. And the questions will be there, control charts, histogram. Histogram will be shown to you and, you'll be asked a question about it. A control chart will be shown to you. You'll be asked a question about it. This is known as control chart. Lower control limit is 3.5 hours. Upper control limit is 6.5 hours. So almost no patient, 99% of my patients are discharged within these times. And this is how my hospital patient discharge process behaves. This is also known as voice of process. This is known as voice of process, VOP. This is how my process is. Okay. And you will get this recording, whatever I'm revealing, you will get all this recording. If you just attend full program, another 20 minutes to go, attend this program, you'll get the recording. You'll also, if you want a certificate also, you can get. I will tell you all the details in a short while. In the Q&A, my team can answer some questions in Q&A. Because I'll take some time to answer individually. So this is known as control chart. And control chart means what? Control chart tells you process is under control or not. So if you are behaving between 3.5 to 6.5, you will say process is stable. Stable, it is under control. It doesn't mean that process is good. See, process under control doesn't mean process is good. Process under control means, like if you go to this hospital, 3.5 hours to 6.5 hours is my natural time. It will not go beyond 8 hours, and it will not be 2 hours. It's predicted. It is predictable process. It's a stable process. But what if I'm doing, suppose one patient took 9 hours. I will say for my hospital, this is little strange. There is a special cause. We call it a special cause variation. This is a special cause variation. And here we say this is a common cause variation. Common cause means a lot of causes are acting on my system and producing this variation. Special cause means there is one special cause which is affecting. I can reveal that, why it happened. Maybe the patient relative went home and we are searching for the patients, and they came back, then the patient could be taken. This was a special cause. It doesn't happen regularly in our hospital. So the special cause are of not much significance to us. As a process improvement specialist, we are interested in the common cause and in the control elements. This is a major mistake leaders commit. They don't understand the difference between common cause and special cause. So they sometimes operate within the common cause, or sometimes they are always worried about the special causes. They start all their improvement problems. There's all this problem. Why this happened? Tell me what happened. No, you spent so much time here in 9 hours. That rarely happens. That's a rare event in a hospital. Forget about it. No, I'm not saying forget about it. It means you have to take immediate action. Sorry, I should correct myself. Actually, special cause, the line of action is immediately you should take an action. Immediately. Call an emergency meeting and solve the problem. And for common causes, don't call an emergency meeting. It will not solve a problem. You have to take improvement projects and change your control limits to new control limits. Maybe 1 hour to 4 hours. Change your control limits. Now, your new control limit should be LCL 1 hour, UCL 4 hours. Even this is also not good, but at least this is an improvement. So you take up an improvement project like Six Sigma. If you want to know about Six Sigma, please attend my yellow belt session. My team will put a yellow belt link also. This is a 2-hour session. You can watch that. This is the recorded video. I keep doing yellow belt session every 2 weeks. In the next program, you can come and attend, or you can watch my recorded video of the last few yellow belt training programs. Anyone, go to the Anexas channel. It's a very, sorry, I forgot to tell you. Please subscribe to my channel, Anexas Europe. Anexas YouTube channel. Name is Anexas YouTube channel. Just subscribe. Every day you'll get two tools. I keep talking about Lean Six Sigma tools and techniques. if you want to know about any tool like failure modes and effects analysis, all CPHQ tools and techniques, cause and effect diagram, Pareto analysis, there are so many tools and techniques out there. Please have a look. I have explained all the tools and techniques very much in detail with examples. And if you watch that, these one tool almost every day, almost every 1 or 2 days I put, whenever I get time, I put all these tools. Like control charts, I'm telling you, but in control charts, in very nice video, with nice suit and everything. And I'll explain, I'll tell you the same concept I have told using day-to-day life example in a video. I'll just demonstrate. As a revision, I'll demonstrate to you. But now, right now, I'm in the teaching process. Sometimes we have to be a little slow. So what I was trying to tell you, common cause variation means, suppose if I ask you, why this patient took 4 hours and why this patient took 5 hours? The answer will be, it is common cause. Don't seek answers. Don't look for, like, why this 4 hours and why this patient 5. Please forget it. It is due to common cause. Common cause means there are so many causes affecting. Make a cause and effect diagram. Discharge time is getting affected by so many causes. This we call it as Y. Always on discharge time, which whatever we are trying to improve, we call it as Y in process improvement. And what are the X factors? These are the X factors. X factors, which are like discharge time is discharge summary time. Discharge summary was, took time. Or reports were inaccurate. Some report error were there. So it took time to, correct the report. Or some hospitals have insurance delays. So there are so many things. So many. Staff is not available. There are so many things. These are all affecting my system and producing this variation. And this variation, we call it as common cause variation. Now, how to deal with common cause variation? You should do an improvement project like PDCA, Six Sigma project, which we follow DMAC, define, measure, analyze, improve, and control. I will quickly show one DMAC project towards the end, I think. Now, hardly 10 minutes are remaining. If you allow me a little bit more time, I can show you a project also. But let me first reveal some of the things. So here, cause and effect diagram is going to tell you what are the causes of my problem. But why I am at 5 hours, average 5 hours, I would like to reduce it, isn't it? So I have to find root causes. So I can make a cause and effect diagram first. Reporting errors, discharge summary time, so many things. Discharge summary time. Now, if I say discharge summary time created by discharge summary time, is delaying my patient discharge time. I have to prove it using data. So what I have to do? I have to collect. So discharge summary time, I took half an hour. Patient discharge time was 3 hours. When I take 1 hour, patient discharge time is 3.5 hours. When I take 2 hours, patient discharge time is 4.5 hours. When I take 2.5 hours, patient discharge time is 5 hours. When I take 3 hours, patient discharge time is 5 hours. So it says, whenever I'm dealing with, this is continuous data. I hope you remember what is continuous data. When I'm dealing with continuous data, I will make something called as scatter plot. Patient discharge summary time and total patient discharge time. So you can see, as There's a positive relation. Positive means when one increases, another also increases. It's a positive relation. So I will say, yes, discharge summary time is the root cause. And I will investigate. I will improve my process. I will do some brainstorming sessions. There are a lot of brainstorming sessions. One of my favorites is 635. 635 technique. Please watch this 635 technique video. See, I'm giving you a lot of videos, like a lot of homework, right? Homework means just look at the videos and you'll find 635 technique is a very good idea generation technique, and you can solve your multiple problems using the 635 techniques. Please watch this 635 technique, brainstorming technique called 635 technique. It's a superb technique. So how to reduce my discharge time? You can use 65 technique to generate some real good solutions. But suppose this was not the case. Suppose your data was something like 0.6, 0.7, 0.8, 0.5. So you always take 5 hours, 6 hours, 7 hours, but patient discharge keeps varying. It has nothing to do with the discharge summary time. Discharge summary time is not the root cause of my patient discharge time. So something else is the root cause. Maybe let's say, staff availability. Staff available, not available, not available. So when the staff is available, I discharge the patient in 2 to 3 hours. When the staff is not available, I discharge the patient in, let's say, 4 or 5 hours. So staff available or not available is attribute data, right? And patient discharge time is continuous data. Now I want to investigate, do a root cause analysis. Is staff availability affecting my patient discharge time? Is it available, not available? Available, patient discharge time is low. When it is not available, patient discharge time is high. Okay. In this case, yes, staff availability matters, and I'll ensure the availability of staff. But what if I get staff is available or not available? Still, I'm taking 4 to 5 hours. Available, not available. Still, I'm taking 4 to 5 hours. This is known as box plot. This is a tool, actually. It's a display, but it is a display of any particular data. When you collect, you can display using box plot. If you want to know about box plot, that also video, I'll give it to you. There's a video which my team will put. What is a box plot? But right now, I'm giving you the overview, bigger picture. So now I will look at this data and say, well, the staff is available, not available. This doesn't affect. So I said, don't blame the staff availability for the late patient. So I'm making data-oriented decision and solving them. Okay. By the way, whenever you complete our session, you also get some videos. Like, for example, we have got multiple videos, and when you join our session, you'll get all the videos. Let me show you, I think, because I've covered one, let me show you the concept of control chart. I've explained using a simple technique. Yeah. So same thing, I've using patient discharge process. I've taken a time from my home to office. So I'm traveling from my home to office every day. I collect the samples, 30, 32, 28, 33, 27. These are my minutes. And if I say, okay, and I find that on an average, I'm taking 30 minutes and standard deviation is 5 minutes. And we know how to calculate the standard deviation and how to calculate the average. Now, if I plot the data on a histogram, then lower control limit would be minus 3 sigma limits. That will be 15 minutes. And upper control limit would be 45 minutes. I hope you got how I'm getting 15 to 30, then 35, 40, right? I hope you are able to correlate with this. This is 35, This is 40 and 45, right? This will be 25, 20, and this is 15. That is plus 3 times the standard deviation. So lower control limit being 15 and upper control limit being 45, I can say that my travel time is going to vary between 15 to 45 minutes. So you can expect me to travel to my office every day between 15 to 45 minutes. If someone asks me why this variation between 15 to 45 minutes is there, I can tell him that it is due to common cause variation. What is common cause variation? I can say that the variation between 15 to 45 minutes is due to lots of factors. These factors can be the traffic on the road, the weather, the car I use, my mood, or it can also depend on at what time I start from my home. So a lot of factors, which we can call it as X factors, are affecting the travel time, which is the Y here. So I can make the statement that the variation between 15 minutes to 45 minutes is due to the common causes. Means all the causes are acting on my system and producing this variation. This is known as voice of process, as if my process is telling, my traveling process is telling that I will take between 15 minutes to 45 minutes. Now, if I take 60 minutes to travel to my office, then same question is asked to me, that why did I take 60 minutes? Then my answer won't be that all the causes are acting on my system and producing this variation of 60 minutes. I might be able to point out a cause. We call it a special cause. So I may say that I took 60 minutes because maybe today there was too much traffic on the road, or it can be any factor. So when I go out of control limits, I can specify a special cause, and we call this variation as a special cause variation. So we have two types of variation: common cause variation and special cause variation. Common cause variation is part of the process, part of the natural variation of the process, and special cause variation is assignable variation. I can assign a cause to that particular event. Now, what is the difference between common causes and special causes? For special causes, you need to take immediate action. Means you need to take a prompt action so that you are able to bring the process within control. But for common causes, you should not take any specific action. Usually, the common cause is within the control limits, and if you want to act upon the common causes, you might have to change the control limits, and changing the control limits takes effort. You may have to do a DMAC project. You may have to do a Lean project. You may have to do a Six Sigma project. And that's what we are doing. That is why we say that Lean and Six Sigma is applied to chronic problems. A process is behaving in a certain way. It is behaving within some control limits for a long, long time. Last 6 months or 7 months, your procurement time has been, say, 120 days plus minus 30 days. And I would like to change the control limit. I would like to change the DNA of my process. And that is why I would need to do a Six Sigma project. To understand the variation, so I will show you a Six Sigma project done in a hospital also in a short while. But before that, let me also, a lot of people are asking about the fees, etc. So these are the topics which we cover. I already told you. You can always have a look at that a little later. And these are the training timings on Saturdays. And you will also get Lean Six Sigma Yellow Belt certificate along with the CPHQ. If you get CPHQ trained certificate, you will also get, in fact, you will get 3 certificates when you attend our sessions. You will get CPHQ trained certificate, you will get CHQE certificate, you will also get a Six Sigma Yellow Belt, because all the topics of Six Sigma Yellow Belt are also covered in our CPHQ sessions. These are the timings. And I'm waiting for you to join my next session. Possible, as every month we have a course. You can join. You can attend as many classes of any batch in the future. So try to ask questions anytime. Not only in the classroom. If you think of a question in your day-to-day work, you are facing some difficulty related to quality, we will be happy to answer you, and we'll be happy to. We all some project, as I was telling, like Lean Six Sigma project, DMAC project. Also FME I was talking about, but as I told you, as I predicted, due to lack of time, I can't teach you FME, but I will give you FMEA full toolkit along with the FMEA template and full explanation of FMEA. This is the the link of FMEA. You can just go through that. So I'm giving you around 1 to 2 hours of more additional content. All these tools and techniques are part of your CPHQ syllabus. Whatever links I have given you, they're all part of the CPHQ syllabus. Failure modes and effects analysis, very, very important tool. Very, very, effective tool to solve any problem in our healthcare system. FMEA. So just now I told about some of the tools. So here, let me talk about some root cause analysis done using define, measure, analyze, improve, and control of our FMEA. Link is given, by the way. My team has just given, so please have a look. I'll request my team, when you're sending the email, can you provide all these links also, useful links? In the email, please provide useful links. That will really be beneficial. Please change the format of our email. Please ensure that tomorrow, and just confirm that we have done it. So Glory Manka, you have raised hand. Would you like to ask any question? Please let me know. You want to come on the panel or you want to ask a question? Just let me know. I'll be happy to welcome you in a short while.
Hi everyone, just wanted to inform you about our upcoming training dates for CPHQ. This is our weekend schedule for next batch starting on April 27th. Or we have another batch starting on 4th May. This is our upcoming session which is going to start. And these are our training timings. Here we have given timings for all different part of the world. So choose your time. If you want if you are from any other country which is listed here, please feel free to ask us. We'll be able to help you. This course content already is explained by Amitabh sir. So again, these are the course content covered each day. The syllabus is day-wise. Topics are mentioned here as per the CPHQ examination syllabus. These are our upcoming workshops. These are free workshops which you can register for. We will send you the link here to register. Please feel free to register for our upcoming free workshops. Now we will continue the training.
And you can also write in the chat box. If you have any question, you can write in the chat box also. Okay, so now coming back to the define. So this is this hospital wants to reduce the OPD patient waiting time. So when we are doing a project, first we write a project charter. We write a business case also, why I should be doing a project. Then we write a problem statement saying that, well, it is taking 90 minutes. Patient waiting time is on an average 90 minutes. And we would like to reduce it to 30 minutes by the end of, typically a Lean Six Sigma projects take 3 months, 3 to 6 months. 3 months for green belt and 6 months for black belt. So there are 2 belts. The green belt means you attend 3 days of training, you become a green belt. You attend 3 more days of training, you become a black belt. Now here you have defined, measure, analyze, improve to DMAC. by when I'm going to complete my different phases. Define means you write a project charter and you also write a SIPOC, supplier, input, process, output, and customer. So this is the customer, patient is the customer. Whenever you are making a SIPOC, you generally make it from right to left. So customer, so output, process, inputs, and supplier. SIPOC, supplier, inputs, process, outputs, and customers. So when I'm trying to solve a problem, generally I have a systems thinking. I told you, right? Suppliers, input, process, outputs, customers. Remember that system? In the beginning, I had told this is the process steps. This is the output, goes to the customer, customer, and then you have a strategy team, then you have suppliers, then inputs. So supplier is from suppliers here. Input is for inputs. Process is for process. O means outputs. And C means customers. The SIPOC is actually derived from that. So if you have an output is a prescribed treatment. Process is the very high level process. What happens in the patient treatment process? What are the inputs and who are the suppliers? So definition of a problem from customer's perspective is that whatever is the output, the customer is dissatisfied about some output. Here, treatment, the time or the waiting time is one of the measures which the customer is dissatisfied about. And it could be due to delay in registration, delay in consulting the doctor, delay in receiving messages. There could be anything, or patient history is not available, registration forms are not available, doctors are not available, receptionist is delaying. There's so many things, these are all X factors. These are all my X factors. Yeah. And this is the why. Okay, too much of spaghetti diagrams there. Okay, so then actually I collect the data, 20, 30 samples, and I find, well, my my waiting time is 90 minutes and standard deviation is around 5 minutes. So I can see what are my control limits, how my process behaves today. I can even make a control chart and I will find the control process behaving stable, but it's not satisfying the customer. It's not satisfying the patient, but process is stable. Process is under control, but process may be under control, but maybe it's not satisfying the patient. So I have to make it something here. That's what the intention is, right? So I do a cause and effect diagram and I find what are the causes. Now, every cause may not be equally responsible. So we do a Pareto. Pareto means Wilfredo Pareto was an Italian economist who found that 80% of the money, 80% of the wealth in the Italy was with 20% of the people. So he called this the 80-20 rule. Now, Joseph Juran applied this to quality. He said 80% of your problems, 80% of your problems are due to 20% of only 20%, maybe, this, or maybe, maybe this. Maybe this, only 20% of that. If we have listed 10 causes, 20 of them, 20% of them are responsible for the 80% of your issue. So which are those? So here you will find out these are the two root causes: time spent in registration and time spent for waiting for the doctor. These are the two root causes. Apart from, there are a lot of waiting times, payment, medicine related, billing, there's a lot of, but these two are the most important, which are contributing to 80% of my total waiting time. So I will work on them. This again, application of Pareto principle. In our session of CPHQ, we will train you how to make a Pareto, a step-by-step method. And see, in the CPHQ exam, you will be given a Pareto, you will be given a control chart, you will be given a cause and effect diagram. So these things, you don't have to make You have to just understand, and you should be able to answer question quickly. See, and when you are actually getting a question, you have only 3 minutes to answer. So your fundamentals should be so strong that by looking at the graph, you know what is the answer. There is no time in making guesses, going back and trying. In our course, we make your fundamentals so strong that by looking at the question, you will get the answer. The 4 options, immediately the answer will come to your mind. And that's the kind of preparation we make for our participants. So here, we applied some tools and techniques. We did some brainstorming techniques. There are some basic ground rules of brainstorming. I will show you that also. There's a video for that as well, actually. Let me show you some video at least, cause and effect diagram. Once we have collected there, Pareto chart videos are there. Let me talk about, let's say, cause and effect diagram. Simple. Basic ground rules of brainstorming. Okay. When you are brainstorming, some ground rules. And 635, I have already told participants about the time, venue, topic well in advance. So they are mentally prepared for brainstorming. As I told you that brainstorming is used for either generating the possible root causes or getting the ideas to solve the problems. There are certain rules which need to be followed in brainstorming. The rules of brainstorming are: give equal opportunity to everyone who is participating. So tell them to participate, and you can use different techniques. As I told you, we will be learning in the improve phase. Capture all the ideas, so document all the ideas. Whatever is being discussed, whatever ideas the participants are given, someone should be there to document, or a scribe you can appoint to document all the ideas. Leave your designation and ego along with your shoes outside the meeting room. That means don't think that if you are senior, your idea carries more weightage. So obviously this ground rule should be very clear to everyone, and everyone should be encouraged to give an idea, and everyone's idea should carry equal weightage. There should be a non-threatening environment. When people are giving ideas, they should not be afraid of giving ideas. So you should create an environment where people should be encouraged to give the ideas. Also, we should ensure that wherever the brainstorming is taking place, there should not be any disturbance, so people are focused on brainstorming. Sometimes people might deviate from the topics. There is a tendency that some important issue crops up during the discussion, so at that time you can always create a parking lot saying that, well, this idea or this issue is very, very important, and we can park it to be discussed after a while once we complete the brainstorming on this particular topic. We should encourage people to fantasize freely. We should not put brakes on our thoughts. So you can give some out-of-the-box ideas, you can give some wild ideas, and if people are giving you wild ideas, they should be encouraged. If you give a specific duration of brainstorming, we should try to complete the brainstorming within the time duration, and defer evaluation. Now this is one of the rules which is often violated. People start discussing the ideas. Someone gives an idea and someone else says, well, it will not work in an organization. Or some other person gives an idea and someone else comments that, wow, it's a great idea. So don't evaluate. Reserve your comments for evaluation at a later stage. When you are generating the idea, when you are generating the root causes, they are not to be evaluated. You cannot say that it is a good idea or this is a very good root cause which you have thought of. No evaluation, just write down whatever is being suggested. Generate quantity, do not worry about the quality at the initial stages. So you have to generate lots of root causes, lots of solutions, more the better. A pearl diver, he dives into the sea to find the pearls. If he just collects 10 oysters, the probability of getting the pearl is very low. But if he collects thousands of oysters, the probability of getting the pearl is very high. So similarly, if you want to collect great ideas, some of the out-of-the-box ideas, some creative ideas, then definitely you should create more and more ideas. So how to generate those ideas? There are different techniques. So one of the techniques I already sent it to you, 65, I told. So I hope you have noted down all the links. Like FME is a very powerful link. Actually, if you have only one like very limited time, I'll request you to watch that FMEA tool. And it's so useful. You'll definitely write back to me. If you use this FMEA, you'll get some so magical results. You will write to me saying, or please do write to me. Please connect with me on LinkedIn. I'm there on LinkedIn. So if you are also there on LinkedIn, just you can follow me if you prefer that way. Just click on the follow button and you can see a lot of tools. As I told you, I keep telling, I keep repeating the same thing, but I every day, every 2 days, I generally put some tools and techniques which will help you to know about quality or improve your quality in your hospitals or clinics. My team can put some of the CPHQ syllabus as some responses of our candidates of our training program. The Cedar Hospital CPHQ response, right?
Okay, sir.
Yeah. So you can, so some of the, a lot of people have attended our trainings and they have given a very nice feedback. Some of the CPHQ certified people have also given us the feedback. And these are some of them. So I'll just play some videos of
our last 3-day course on the CPHQ exam preparation. It was awesome. We covered the majority of the topics in a very targeted and focused way that allows us to later on focus our studying and our energy and our time on what really is of value for the examination, but more importantly as well because of the practical examples that Amitabh was able to provide us in our everyday healthcare work. One thing that I really benefited from the course is that Amitabh from Anexas was able to provide us with answers and solutions, especially at the statistical level, to questions and problems beyond the CPHQ course, to exercises and projects that we do in our everyday work life. For that, I would definitely recommend the course, taking it with Amitabh and Anexas. It's been a great experience, both for my preparations for CPHQ, but more importantly for my everyday work. Thank you so much.
Hi, so I've just completed 3 days training of the CPHQ, which has been absolutely fantastic. Amitabh from Anexa has been phenomenal. The course materials have been fantastic. I think what I really enjoyed about this was that I could relate a lot of this methodology to healthcare, and a lot of the examples were things that I could contextualize it with healthcare. So I'm from here in Qatar at Sidra Medicine, and so again, thank you to Amitabh for this fantastic training.
Hello friends, I'm Dr. Jyoti Bala and I have recently cleared my CPHQ examination with a wonderful score of 88%, and I'm really grateful to Mr. Amitabh Saxena and all his team. So Anexas has done a wonderful job training me for CPHQ exam. I could crack the exam pretty easily. The materials provided were very up to the mark, were very appropriate. I mean, I really had to work hard with them for a couple of months, but it wasn't that difficult as such, and I really wish all the candidates great luck, whoever are appearing for CPHQ examination, and I highly recommend Anexas training for the same. Thank you.
So there are many credentials like these, and I would like you to also be one of them. Our whole intention is to generate excellent credentials, and I'm looking forward to meet you in my sessions. Most welcome.